Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. For iron replacement might be easier, more effective treatment for iron deficiency anemia. Mednews, a new study found that women with iron deficiency anemia caused by heavy menstrual bleeding may be better helped by intravenous, iron replacement compared to oral iron supplement tablets. The study showed that a single dose of iron helped women maintain healthy blood iron levels for at least 30 months, compared to oral supplements which had the anemia return within 36 months. The iron treatment was also found to be more cost-effective than oral supplements. Researchers plan to continue refining the model and make it available to help patients, doctors, and insurers evaluate treatment options for iron deficiency anemia in women. This is a prevalent global issue, and researchers hope others around the world can adapt the model to their contexts and continue building upon it. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak